Doctors, nurses, EMTs. What was the most severe injury disease that the patient refused help to treat? Bullet wound to the head. If the bullet doesn't hit the brain, you can avoid the worst consequences. Unfortunately, it also causes the person to go into a state of shock, which may cause them to resist attempts to help them. I used to work in an ambulance. It was common for us to receive a call from a 911 dispatcher with almost no additional information, just the patient's address and, at best, details of their condition or complaint. We once received such a call from an apartment complex, a real shithole. When we arrived on the scene, we saw that a fire department vehicle had already beaten us to the scene. I asked one of the firefighters what happened to the patient. He shrugged and said he didn't know anything. The lieutenant just told him to tell us to be prepared for the risk of infection and to put on all personal protective equipment, mask, gown, gloves, goggles, etc. Anyway, I walked through the door of the apartment, and the first thing I noticed was a naked girl about 20 years old who was covered in blood and lying unconscious in the corner of the room. A second girl in about the same condition was giving minimal signs of life and was lying on the couch. She was talking to the firefighter and struggling to say the words. As my partner and I began to approach these patients, the other firefighter, he took us by the arms and dragged us into the bedroom, where we were apparently even more in need. What was your first impression of what you saw? Do you remember the scene from A Nightmare on Elm Street where one of the main characters was being dragged across the walls and ceiling of the bedroom? I seemed to be watching the scene of the exact same incident. Blood was dripping from the ceiling, there were bloody palm prints and bloody streaks on the walls and floor. The room was empty except for some high-end filming equipment in one corner, and in the center of the room was a blood-soaked mattress on which a man was lying in the fetal position, rocking back and forth, clutching a tattered pillow. It turned out that the man had invited 2 call girls over and started videotaping the whole act. Unfortunately for the man, just before he ejaculated, one of the girls committed a careless act, breaking his hose as a result. As a result, blood splattered from his device onto the ceiling and onto the girls. This undoubtedly frightened and took the girls by surprise, so they started running around the room, smearing blood all over the place. The cherry on the cake was that the man refused a trip to the nearest hospital and subsequent treatment, even though we explained to him that he might never be able to be intimate again or even just urinate normally if he didn't come to the hospital with us. Fortunately, the law enforcement officers who arrived were able to straighten him out a bit. I work as a nurse in a nursing home. A patient had gangrene from knee to ankle down to the bone. A year or 2 before entering the nursing home, she had a chance for amputation, but she refused, saying she just wanted to die. She was slightly in her 80s, in her right mind, and had no other major health problems. And instead of living another 10 years, she died in terrible pain. We changed her dressing every other day. We had to pump her full of drugs and painkillers to do this. As a result, she was unable to have intelligent conversations with her loving family and friends who came to see her every day. I am still a fairly young nurse, and this was the first time I saw gangrene with my own eyes. Seeing it wasn't that scary yet, but that smell.
She passed away already 4 months ago, but there is still the smell of rotting flesh in her room. A pregnant Jehovah's Witness was involved in a car accident and refused a blood transfusion. 5 hours later, the baby died. Then she herself died. A very serious motorcycle accident. His left leg was crushed. We couldn't even figure out where his ankle was because he had bones sticking out. We did our best to clean his leg, then covered it up while waiting for the doctor. The motorcyclist said he couldn't wait any longer and that he would take care of the injury himself at home. Got up and left, staggering away. I always wondered what happened to him in the end. I work as an emergency room technician. A very large male with diabetes came into the department. His leg was wrapped in a plastic trash bag. The ER staff said he refused to remove the bag. They didn't even have to tell us that something was obviously wrong there, as the stench from this man was horrible, even in a very well-ventilated room. Eventually, The nurse threatened and coaxed him into removing the bag, and we saw that the entire lower half of his foot had turned into a nightmarish mess of gangrenous flesh. The foot was really just black. I had only been working in the ER for 2 months at the time, and it was the first time I had ever seen a wound that made me sick. The smell soaked everything around me. I can't even imagine how the other patients felt. He was told that his limb had to be amputated or sepsis would occur. He was in complete denial, insisted there was nothing wrong with him. He refused treatment and left the clinic under his own power. I don't know what happened to him afterwards, but he begged for his garbage bag back.